now and live streamed on YouTube as a way for members of the public to participate. Please state your name when making a comment or asking a question, and I will ask that you keep your microphones on mute when you are not speaking. We will now begin the meeting with a roll call of members.
Thank you very much, Madam Chair, members of the committee. When I call your name, please unmute and share the fact that you're here as well as your affiliation, please. Thank you. Karen Bishop.
Here.
Thank you. Santiago.
Here, City of Tolleson Human Services Department.
Thank you. Melanie.
Here, Tony Gilbert.
Thank you. Seth Dyson. Jerry. Hey, Jason. Jason here as a proxy for Sean Pierce. Yep. Eliana.
Here for Valley of the Sun United Way.
Thank you. Susan Hallett. I know she's running a little bit late. Marilyn Kasanick. Lisa Maddox.
Here, City of Peoria.
Thank you. Christina Penitescu.
Here, City of Goodyear.
Thank you. Kira Peters.
Hi, Amy. Here, Kira Peters, City of Scottsdale.
Thank you. Chris Charlo.
Kristen Charlo, City of Tempe, Community Health and Human Services.
Thank you. Amber Wakeman. Christian Zabrowski.
Here, City of Buckeye, Human Services.
Thank you. Did I miss anybody? Okay, thank you. We do have some folks who are here joining us today as speakers, which is fantastic. We thank you for your time. We also have some friendly observers that are coming in support of mainly the presentations, but also as future committee members. All right, Madam Chair, back to you. We do have quorum.
Great, thank you. And again, welcome everyone. So next up is the call to action. This is the opportunity for the public to comment on items that fall under MAG's jurisdiction that are not on the agenda or that are on the agenda for discussion and not for action. Members of the public could submit written comments via the MAG website 2 hours prior to the meeting. And as I understand it, we do not have any written comments for this item. Is that correct? Are there any other comments or it's only written?
Madam Chair, we have not received any comments. The only comments that would have been submitted would have been written since this is a virtual only meeting. Thank you.
Perfect. Okay. Next up is approval of the November 7th, 2024 meeting minutes. Does any member of the committee have any questions or corrections to the minutes? If not, could someone please unmute and make a motion to approve the minutes?
I'll make a motion to approve Melanie Gilbert.
And this is Jason Matthews. I second.
Great, thank you. We have a motion from Melanie, a second from Jason. We will now have members take part in the voice vote by turning on their cameras and unmuting their audio. For those who cannot or do not want to turn on their cameras, we will conduct a roll call vote. So members, please leave your cameras on until after the roll call vote. Can I have a voice vote from the members? Those in favor say aye.
Aye.
Aye. Those opposed say nay. And then, Amy, do we need to take a roll call vote of any members?
Madam Chair, we do not. All members have their cameras turned on and the motion passes. Thank you.
Wonderful. Thank you very much. All right. Item number 4 on the agenda. During our last meeting, this committee requested a presentation on dementia-friendly communities. Janice Greeno with Banner joins us today to offer an overview of their work as the state lead for Dementia-Friendly Arizona. She assists many communities in taking active steps to be welcoming and inclusive of people living with dementia, their caregivers, and their families. Janice, the floor is yours.
Thank you so much, Christina. And it's such an honor to be here with all of you. Thank you to everyone on the Human Services Technical Committee for being here today. And it is also an honor to just be here with you, Amy, and with all of our panelists today who are leading their communities in making a difference and building more dementia-friendly communities. This has to be done in a strategic manner. So the topic today is strategically building dementia-friendly Arizona. As Christina said, my name is Janice Greeno. I'm the Senior Outreach Program Manager at Banner Sun Health Research Institute and Banner Alzheimer's Institute, and I'm the state lead for Dementia Friendly Arizona. And I would like to share, first of all, what dementia friendly even means. So dementia friendly communities are grassroots communities who come together as influencers for change. They're catalysts making a difference by building more dementia-friendly communities. And these communities support people living with dementia, their caregivers, and families. Now, we build teams in each community, and those teams are very inclusive of people living with dementia and their care partners so that we can hear their voices. And they include influential leaders across the sectors of each community. Now, you'll hear a little bit more from our panelists, and Jamie Ryan will be sharing a little bit more about that. But right now, I want to share with you about why the need is so great. Will you please advance the slide? There are currently over 7 million Americans living with Alzheimer's disease. Back in 2020, it was estimated that there were 150,000 Arizonans 65 and older living with dementia. And at that time, they estimated 257,000 family caregivers in Arizona alone. Unfortunately, we are the fastest growing state in the nation. And at that time, they projected we would see a 33.3% increase of cases by 2025, and that is in less than a month. They projected we would see 200,000 cases by then. Some of you are aware, and then some might not be aware, but according to the Alzheimer's Association and so many people in the research field, 10% of people 65 and older have dementia. And age is the biggest risk factor, although it is not a normal part of aging. 50% of people are estimated to have dementia 85 and older. There are so many more statistics you can find out about in the 2024 Alzheimer's Disease Facts and Figures Report, and you can check that out and find their resources at alz.org. Please advance the slide. Before I get any further, you might wonder, what is dementia? Before I share what it is, I want to share what it is not. Dementia is not a disease. It's an overarching umbrella term used for the loss of memory and other thinking skills severe enough to impact someone's everyday life, to hinder people from doing things that we often take for granted. And you can see here that this umbrella term, and when I say umbrella term, imagine the word cancer. And if someone had cancer, you would want to make sure and get a diagnosis that was accurate so that the appropriate cancer could be treated. When it comes to dementia, the most common of the dementias is Alzheimer's disease, and that is 60 to 80% of all cases, but you might have heard of many others: Lewy body, vascular, frontotemporal, and others, and combinations of them all. Next slide, please. In the pictures, you could see that you had somebody who was older living with dementia and somebody you might not even have expected to be living with dementia. You couldn't even tell by looking. We want to support all families across the spectrum. And in Arizona, I am thrilled to share that we have 12 dementia-friendly communities, and it all started in Tempe as one of the first dementia-friendly communities in the United States. Now, I don't want to steal somebody's thunder, but there's somebody on the meeting today because after I sent this PowerPoint out, one of our communities became community number 13, so I won't steal their thunder, but we now have 13 dementia-friendly communities in Arizona. Please advance the slide. Some might wonder, why is Janice from Banner Health sharing this presentation? And I want to share that Dementia Friendly America licenses one program per each state. And Banner Alzheimer's took the initiative to lead this for the whole state of Arizona. And not only do they do this to give back to the community and to make a difference, but there are all kinds of free resources and free education, in-person support groups, virtual support groups, and you can find it all at bannerhealth.com/Alzheimer's. You can even become part of the newsletter, the Beacon newsletter that goes out that has a special section about dementia-friendly efforts in Arizona. You can also go to the calendar, bannerhealth.com/calendar, and we have a drop down for Alzheimer's and other related dementias where people can find out more about these upcoming classes and support groups, resources that are available in the community, in addition to the wonderful research and clinics that we have. So I hope that if you are in need of this information, that you will use this resource that's available to you. Next slide, please. People often ask, what does it take to become a dementia-friendly community? And of course, there's an application process, but it includes convening that action team that I spoke of, engaging key leaders to find out what the current strengths of the community and the current gaps in the community are. I said this is a grassroots effort, and that means each community is going to see different things that are their strengths or that are opportunities. And then analyze those needs, determine the issues, and set community goals. And finally, develop that action plan and implement it throughout the community. It needs to be strategic. And what we have found is that together we are stronger. And I just love that about working with all of you, Amy, on your team, and that you are stepping forward and just sharing this information today. We think it's critical that we're collaborative in this initiative. And as the program grows, more and more communities are asking how to get involved. And it's more important that we bring everyone together like you have done today. Next slide, please. One of the things that our communities do is create and build memory cafes. Memory cafes are wonderful places. If you haven't been to one, I encourage you to do that. We now have over 20 in the state of Arizona. When I started getting all the memory cafes together, we had 5 or 6. And so it's grown exponentially. And we invite people living with dementia to just come to a relaxed environment, hang out, have some coffee and snacks, have life enrichment activities, find resources, hope, and education. If you want to find out more, you can email Banner Research at bannerhealth.com, or you can call me or email me at janice.greeno@bannerhealth.com. Next slide, please. you might be saying, hey, in our meeting today, there's just not enough time. I want to know more. Please check out Dementia Untangled, our podcast that we started for caregivers in the pandemic. It has grown now. We have had 100 episodes, and it's been a great resource to not only caregivers, but people living with dementia and professionals. And one of our professionals, who's now retired and a volunteer with Dementia Friendly America, is Barbara Mason. And her episode is called Influencing Change Through Grassroots Movements. And she shares her own story about caring along with her husband for her mother-in-law and how important that was for her to be there and how important it is for her today to share resources. Next slide, please. You might also have heard me say Dementia Friends and Dementia Friendly. The Dementia Friendly initiative for our communities is like an umbrella that includes raising awareness. And we raise awareness through Dementia Friends information sessions. This program was developed in the UK, but in these sessions, we help people understand what dementia is, how it affects people, sharing those early signs and symptoms, and how we can make a difference, whether in big ways or small ways, for these families. Next slide, please. In the Dementia Friends program, champions are the cornerstone. Someone like me, a champion trainer, trains champions. Champions go out in the community and they can meet in someone's living room or maybe a faith-based organization or at the city and share a Dementia Friends information session that's only 1 hour, but so often it's the first time someone has heard about what dementia really is and where they can find resources, help, and hope. Next slide, please. And if you like QR codes, I have so many for you today. To make it simple for you, if you want to sign up for that Beacon newsletter, listen to the podcast, you might be inspired, like our incredible volunteer research participant heroes, to just find out about research studies. You click on that QR code and you can join endalznow.org with our Alzheimer's Prevention Registry, which is collaborative efforts across organizations across Arizona. Maybe you need an appointment or know someone who does, or I mentioned those websites. You can find the Banner Health calendar at the final Find Classes and Events QR code. And we always thank the Banner Alzheimer's Foundation because of them, we're able to lead this initiative. Next slide, please. And with that, I just want to thank you, and I look forward to facilitating this wonderful group of panelists for you.
Madam Chair, back to you.
Thank you. Are there any questions for Janice or the panel?
Just real quickly, could you show the slides of the slide that had the list of the cities? Thank you.
Do you want to tell? Well, so there are a number of communities who are making progress towards becoming more dementia friendly, and we're excited to feature our own committee members and their teams as they showcase their work. So thank you, Janice, and I look forward to your help as we move into this local dementia friendly community panel part of the agenda. We hope communities that aren't yet engaged in these efforts and those that are already engaged as well will learn and share something from the dialogue today. First, we have Jamie Runyon joining us to talk about the work Buckeye has done to start their efforts. Christian, would you like to say a few words?
So it's Christian from Buckeye. I think being involved in the initial stages and seeing how the program delivery is coming to a new area, it's not only inspiring, but it's palpable to see how the reduction of stigma, the fostering of the understanding of what dementia is and the many variations of dementia. It really just leads to empowering our community and fostering the independence for our community members. And I just feel honored to be surrounded by such great staff, the support from our neighboring cities that have already had the programs rolled out. It's true partnership in front of your eyes. So I'll let Jamie share a little bit more of the behind the scenes, what's been going on in Buckeye, and ready to go.
Sounds good. Jamie, did you want to do that right now or as a part of the Q&A with the rest of the panel?
Amy, did you have a certain agenda?
Yes, Madam Chair, members of the committee, Jamie, if you want to go ahead and present your PowerPoint first, and then right after that, we can pause for a few questions, and then Janice will moderate the panel with the other speakers, and then we can open it up for Q&A for the entire panel at that time. Thank you.
Perfect. Good afternoon. Thank you guys so much for allowing me to come and speak. I am beyond excited, absolutely excited for what we're doing, how we're doing it, and what Buckeye is really, really embracing. So I'm super excited. Amy, just so I know, do I have control of the toggle or do I ask you each time?
If you don't mind saying next slide, that would be great.
Absolutely.
Perfect.
Next slide. All right. So introduction to dementia-friendly communities. So dementia-friendly, as Janice kind of alluded to, really aim to foster the awareness, support, and resources for individuals with dementia and their caregivers. Dementia-friendly Buckeye was established in April of 2004. So, I mean, we can count how many months that's been. It's not even been a year yet. And the strides that we have done thus far are truly exciting. Our mission in Buckeye is to create a supportive, inclusive environment where everyone affected by dementia feels valued and understood. And it's not just the ones who have been diagnosed, but their family, their caregivers, everybody who is affected. Next slide, please. So the current progress and plans, boy, our minds keep going. We are so excited out there because there is just so much that we can do. So right now, the community information sessions. So current state, what we have as a goal is every quarter to be able to do a community information session where we kind of engage the whole community to come and hear from a speaker, someone who is in that field and can really kind of give some great information. And we hosted one in 2024 at the library, and it really did well. We had a good community outreach. We had a lot of questions afterwards, and then we just had a lot of engagement surrounding it where people are wanting to be a part of it. Upcoming memory cafes. So we are going to be hosting our very first one in January. So we will be doing the second Tuesday of every month starting January, and we will have a monthly gathering at the Buckeye Senior Center, and everyone will be able to come together. Next slide, please. So what's a memory cafe? I think that's the biggest thing that we hear. You know, when we are a part of it, we think it's just like, oh yeah, memory cafe, come on. They're like, well, what is that? What are we doing? You know, and so I want to first state that every memory cafe gets to be just a little bit different. And that's the great thing about it. Every memory cafe gets to kind of create what that looks like. For Buckeye, our initial creation, and I say that because things can change as time continues, but what our initial creation is really having a very welcoming space for everyone to join together for the first 30 minutes. Kind of exchange coffee, conversation, engage others to other family members that are struggling or succeeding, you know, in what this looks like. So we're all together having treats and coffee. And then what we're going to do is we're going to divide the group. those living with dementia, we call them the VIPs because they truly are the VIPs. So the VIPs get to go into a section where we call life enrichment. And sometimes it's chair yoga, sometimes it's dancing, sometimes it's singing, sometimes it's just pacing the floor, and that's allowed too. You know, we really kind of make sure everybody that we have in life enrichment is used to all the different types of folks that might be coming in there and the different nuances of everybody. And then the caregiver, the loved one, the support person gets to go into a support group. And really what that looks like month to month, it's truly different. Some months we just kind of talk about, man, my loved one keeps overwatering our cactus. I don't know how to make them stop, you know, and the whole group is like, oh, I found something. Mine did the same. And being able to exchange that back and forth to the holidays are coming and my husband was always the one who carved the turkey. I just don't have the emotional bandwidth. And being able to say, I remember my first one too. And having that support and connection where everyone else is like, I get it. But everybody's at a different journey. You know, we can't just, you know, blanketly say everybody's at this stage. It's been 4 years. This is where you should be, because that's not how it works. And then we really want to make sure that we connect them with resources. I think that's one of the biggest things that we hear so much is that folks are like, I don't want to tell anybody, but I think my husband's struggling. I think my wife is really struggling. What am I supposed to do? I don't know. I keep locking the door. They keep getting out. They keep driving and they shouldn't be. And really trying to help them find those key resources that they feel that they can say, oh, okay, I do have help. Next slide, please. So why caregiver support matters. I think really the inclusiveness of it all. So the challenge, caregivers often manage complex emotions alone, leading to burnout and isolation. So a little story, a local caregiver, Jane, shared how she struggled to balance her own life while caring for her husband with dementia. Through support groups, she found solace in shared experiences and discovered practical tips to navigate her journey. When you're in the midst of it, sometimes those simple, common things don't make sense. They don't come to your head. You know, having a lock up top where your wife can't reach it because she's only 4'11", sometimes that just doesn't come to your head. And somebody else saying, oh, have you tried this? So the benefit, the support groups provide caregivers we provide them with validation, coping strategies, and a sense of community. Next slide, please. So the benefits of dementia-friendly community. This is one of the pieces I am most excited about. So increased awareness. The educational initiatives help residents understand dementia's impact. So we have all been going out already and really talking to the Buckeye community. And Buckeye is our big little city. You know, it is one real big city that everybody thinks is just a little city way out here. And it is one of the most amazing little big communities. So already talking to some grocery store folks and listening to them say, I have someone who comes in here probably once a month and they just wander. I never knew what was going on. Now I might ask questions to see if I can help. One of the gas stations off of I-10 have said, boy, we have a few of those. They come from California sometimes. They get in their car and they just start driving and they end up here at our gas station and then nobody knows what to do. And so we've already started to engage them to say, we would love to come train your staff. Just those little things to really recognize. We were able to go and train a yogurt shop, a frozen yogurt shop this month, or excuse me, November. And it was so heartwarming to hear some of the young high schoolers say, we have a set of sisters that come in here. And one sister says she just needs to walk the block a few times while her sister is safe in here. And that sister tends to go and get extra toppings and those kinds of things. And in a frozen yogurt shop, you're not supposed to do that. It's all supposed to be weighed. But they have realized that it's okay. you know, and so training their staff and those that come in and out of there to be able to understand those little nuances of folks. Enhanced resources, really creating the awareness around what we really do need far out west. You know, what does that look like? Sometimes it's transportation. The wife wasn't the driver, you know, those kinds of things. Support of businesses, encouraging businesses to expand to Buckeye to serve the growing population. Improved quality of life. Say it again, improved quality of life. Activities like memory cafes promote socialization, reducing isolation for those with dementia and those that are caregiving. Next slide. Buckeye demographics. I bet Christian can really recite these ones. You know, it is a growing, rapid little city, as I said. Last year, 2003, the reports I showed were about 108,000. I know we have surpassed that. Residents age 65 and older make up approximately 10% of the population, translating to over 10,000 seniors. Again, we have surpassed that. But who could benefit from dementia-focused programs? Next slide, please. Resource awareness and growth. So partnering with local organizations to provide information on dementia care, such as non-medical in-home caregiving. Sometimes we say that mouthful of words and people are like, what does that even mean? Is it covered? What do we do? How do we do that? Being able to tell them what that looks like. Hospice and placement services. And then actively promoting businesses and nonprofits to expand their reach into Buckeye, having different ones come out that can be a benefit for those who are struggling. Next slide, please. And our call to action, you know, this is where I want to stand out on the mountaintop and just say, hey, everybody, for all the city workers, your support can help us increase awareness and build partnerships, really knowing what's out there from different food pantries to different transportation companies, those kinds of things, really understanding what is already there so we're not recreating the wheel. And for the community, together we can make Buckeye a beacon of understanding and care for dementia families. Next slide, please. So where to start? Become a dementia friend, as Janice just kind of talked about. It's an hour course, I say. I always say it's an hour of fun. And just really understanding what it is. So become a dementia friend. Direct folks to resources that are already out there. And understand that it is hard to ask for help. A lot of our folks really struggle saying that their wife is not okay or their husband is not all right. It's a hard statement to say when it's not an actual something that you can pinpoint like, oh, his heart is bad. To say someone's mind is not okay is hard. Next slide, please. Ta-da! I was trying to watch our time. How'd that go?
Awesome. Thank you, Jamie. That was great. And a great way to tee us up for the panel discussion. So we are going to have a panel presentation with Francisco Blanco from the City of Phoenix, Kira Peters with Scottsdale, Mary Measy with Tempe. I hope I pronounced your last name right. And Michelle Yates from Glendale. Thanks to all of you for being here. Janice is going to moderate the panel. Amy, do you want to give us a sense of how much time we have for the panel discussion?
Well, it's about 2:36 right now, so maybe if we go about 15 minutes for the panel discussion, if that's okay, we'll get through as many questions as possible. Quick time check. We do have a pretty significant agenda item after this. If folks can remain on until 3:30, I think that will cover us. Does anyone need to leave right at 3? Okay, excellent. Let's proceed with the panel then. Thank you, Madam Chair.
Back to you, Janice.
Thank you, Madam Chair, and thank you everyone for being here. Jamie, that was fantastic. I so appreciate you and all you've done in the leadership with Dementia Friendly Buckeye. Now we're going to become just a little more relaxed. Imagine that we have a round table, kind of more like a panel. And I was thinking first that we would start with Francisco Blanco. And Francisco, please share your title. I remember the first time I met you. I don't think I'll ever forget that day. We were in Mayor Kate Gallego's office and we were kicking off Dementia Friendly Phoenix, and the very first COVID case came into Arizona, and she had to leave the meeting early, and our lives were forever different after that. So Francisco, will you start with us today? I just have a couple questions for you. If you would just make sure that your mic is on.
Yep.
But a couple of questions. What prompted Phoenix to become a dementia-friendly community, and what outcomes do you hope to achieve?
Right. And thank you, Janice. And you're right. First time we met was the first day that Mayor had to address the issue locally. Again, my name is Francisco Blanco. I am a program coordinator for the City of Phoenix Human Services Department in the Senior Programs Division. We have 15 senior centers across the city, as far north as Pinnacle Peak, as far east as 67th Avenue, or west, excuse me, and as far east as basically the border of Scottsdale, and as far south as the 202 or Pecos Freeway. So everywhere throughout the city, we have centers very geographically dispersed. And that's one of the reasons that we wanted to start the program. Besides the fact that Mayor Kate Gallego had a personal vested interest, and she's been a huge champion of our programs, we wanted to touch the different areas of the city since we already had such a diverse demographic reach. It kind of fell in line with what we were doing already, and we wanted to increase our ability to help with public health. And we just felt like it was a good place to leverage our resources, since we already had so many centers out there in the community. Some of the things that we wanted to start with as far as our goals were to increase awareness and understanding of dementia-related dementia and the related symptoms around it, improve accessibility and support to our participants throughout our senior centers. So typically, our senior center participants are more the caregivers. So we do have the memory cafes, which we'll get to, that are actually for the individuals living with dementia, but a lot of our members are actually in the caregiver side of the population. Of course, enhance the caregiver support and better coordination of services. So we were hoping to partner with other great partners across the valley, like Janus and Banner and some other universities that we've worked with over the process, and really just work to include the population in our centers and reduce the isolation for the caregivers out there as well.
Absolutely outstanding. Thank you, Francisco. And hey, you did something super unique that no one else in Arizona has done yet. And it was yesterday. Can you share a little bit about that?
Sure. Actually, so we've grown. So our very first cafe was actually in 2020 during the pandemic, and it was virtually. And then from there, we got funding to have a small program, and the funding has kind of run its course. But of course, working on sustainability from having the program in a few centers, we've expanded to all 15 centers. But throughout that program, while we had the small team, we had Dementia Friends. So we had some Dementia Friends champions that were out there in the community actually doing the training and training people at various locations. As of my most recent report, I believe we had 44 Dementia Friends trainings across the city. And as of yesterday, we trained all 51 of our staff members to officially be Dementia Friends champions. So anybody from anywhere can actually go on our website and just request a training, and then we will provide a staff member to go out there and do that in the community for free.
Thank you so much for that opportunity. And it was so exciting to be able to do that for the very first time. And the fact that he mentioned that you might not have caught is that you can go on the website. So many of our dementia-friendly communities have a website, but with Francisco's City of Phoenix website, it's incredible to see the calendar of all the memory cafes across the whole city of Phoenix and how many they have per month. It's just full of services and supports. And thank you so much for expanding that yesterday, Francisco.
That's right. And thank you so much for teaching that, Janice. And I did fail to mention too, we do have still going every month 2 virtual, 16 in-person cafes, and then 2 caregiver support groups at any of our various centers. So essentially on any given day of the month, we might have 1 cafe going on in the community near you.
Incredible. Thank you again. And thank you for kicking off our panel. And I'm thinking about having, hey, Michelle Yates, would you like to share what prompted Glendale to become a dementia-friendly community? And what outcomes are you hoping to achieve?
Thank you, Janice. My name is Michelle Yates. I am the Deputy Director here with the City of Glendale Community Services Department. About 3 years ago, a little bit before that, I received a call from the city manager's office and the mayor's office, and we had some interest in launching this concept in the city of Glendale. And with my role at the time, it fell in my lap, and I'm very, very happy that it did. I was able to make some connections with some community champions to understand a little bit about what Dementia Glendale, Dementia Friends Arizona, Dementia Friends America, what that looked like. How we can work together, really just try to visualize that. And we launched, we really hit the ground running, and we launched this program very, very quickly. We had the support of the mayor as well as my director at the time and other community partners. We had pulled together a very strong action team, which is one of your requirements when you do set up a dementia-friendly city, is you need to establish that action team. And I would have to say just having those members there at that time, it didn't take a lot of effort to secure the right people at the table, to have the right people at the table, made it very seamless process to become a dementia-friendly city. So we've been a dementia-friendly city for 3 years. I felt like we have made a lot of progress so far. Not Francisco, not as many dementia friendly memory cafes as you, and I'm gonna have to give you a call. But we've put together a nice solid action plan, with realistic goals. We have a strong action team that meets every month. We've completed 3 awareness events, 1 each year. We've done in-person training. We've done resource community vendors that come out to provide the resources. We've done on-the-site brain checks for the community. We also host monthly memory cafe sessions. But one of the things that I'm proud of so far with our outcomes is we really wanted to train our employees, right? We wanted to make sure that we were making it, again, to Jamie's point, quality of life is everything. The community experience for individuals living with this disease and their caregivers is really like the #1 thing for me. And so we have successfully trained 25% of our organization, targeting all police and fire and all of our frontline staff. So those that are doing direct service delivery. And I think that goal, when we put that together, that was a big a task, but I'm so proud of that task because it was something that was needed and a great resource for our employees here in Glendale. In addition to the training, though, we've also incorporated free brain checks into our employee health fairs. So not just for the community, but we got to take care of our own. And so we do that with our employees and partnered with Janice and her team to do like a questionnaire and launch it. Because if we can have our employees talking about this topic, and handle it, take care of them and handling it at their home, at their level, it just helps us push the message out that Glendale does care about our community. We have over 26,000 people over the age of 65. And as we all know, our communities are all aging. So we really believe, and the data doesn't lie, 33% of our population is going to increase between 2020 and 2025, and 2025 is less than a month away. So we just felt like we had to kick it in gear and put together a plan.
Thank you so much, Michelle. And, when we talk about building a strong action team and having influential participants on the team, we were so fortunate, so blessed to find Michelle and have this program, as she says, fall in her lap. She has been incredible. What a connector and what a difference maker Michelle is. And she's so creative and so fast. And Michelle, I just want to share that the work that you did to secure the main library to be our place for our 3 annual events now to raise awareness about dementia. And then this last one to have a carnival approach that the whole family could come to raise awareness, because we all know that not just people who are living with dementia are impacted, their whole family is impacted. And so thanks for that creativity, and thanks for all of the great work that you do. Okay, next up, how about Mary? Mary, would you please share with us, Tempe started this all, and what prompted Tempe to become dementia friendly? And what do you hope to achieve?
Thank you, Janice, and thank you, Amy, and the committee for having me today so we can share about our experience. My name is Mary Mazie. I'm the Deputy Community Health and Human Services Director in our Wellbeing and Empowerment Division. So that's where our Dementia Friendly Tempe initiative is housed. And so, Janice, as you shared, we did kick it off. It's a huge point of pride for us here in the city of Tempe that we were the first dementia-friendly city. And our start really was a personal one. Our then mayor, Mark Mitchell, he was inspired by his family's personal experience with dementia. And so from that lived experience, he really recognized the need for our city to proactively support our aging population and foster a more inclusive community. And so we kicked off our efforts. We launched that through our first Dementia Friendly Tempe Summit, and that was in March of 2016. And I'm really proud to say that last month we had our 8th annual summit at our Tempe Center for the Arts. So that really just goes to show that this effort has been sustained and it remains a priority for our city leadership, as well as our community. We had nearly 200 folks attend from all walks of life, wanting to engage and learn more. And also, we're really proud that this work also aligns with our designation as an age-friendly community with AARP. And so I'm just really appreciative, Janice, of that start that you gave us with Banner to get us started on this pathway. Really want to thank to our staff and our dedicated volunteers that have been sustaining our effort. Really, the goals that we have is to make sure that we are creating and providing a community of hope and support here within Tempe. So some of the things that we're hoping to achieve are, really focusing on empowering individuals with dementia, addressing social isolation, helping them remain active in our community. And, Janice and Jamie, as you both highlighted, support for caregivers is really critical. So we've been really focusing on providing those robust programs, our memory cafes, as well as having some intense resource referral for caregivers. And we also have monthly Dementia Friendly Presents educational workshops, and we gather the topics for those workshops directly from caregivers as well as other invested community members. But really with that hope to support caregivers in managing stress and accessing resources. And like others have said, we really want to ensure that residents and our city staff and businesses understand dementia. So we, since 2016, proud to say that we've held over 100 training sessions for the Dementia Friends training sessions, really focusing on city employees, especially in public safety, those here in community health and human services, as well as looking to partner more with our Tempe Chamber of Commerce to engage more of our business partners. And so really looking to continue to expand our programming. So our memory cafes have been such a success that we started off with one a month, and now we are meeting 4 times a month here at the Tempe Public Library. We've also added an additional session at one of our other senior centers. On the other side of City of Tempe, we're only 40 square miles, but we have invested interest from our community for these programs. So we've added a second location so that we can better connect participants where they're at to these essential services. So just appreciate learning from other communities. I just jotted down the idea of doing that, those brain checks with our employees. So look forward to learning more.
Mary, that's so incredible. Thank you so much for taking the lead. And Amy, I am looking at the time, and I know you told me you'd let me know on time how we were doing, but I'm thinking we just have a moment for Kira from Scottsdale. Is that right?
We have time for Kira, absolutely.
Oh, good. I'm
Yes.
so glad.
Yes, please.
Kira, share with us a little bit about what prompted the city of Scottsdale to become a dementia-friendly community, and what outcomes do you hope to achieve?
Thanks so much, Janice, and nice to be here with everybody. Luckily, I'm a fast talker, so I'll move along quickly, Amy. But similar to all of you, the other municipalities, Scottsdale is definitely an aging community. And so we really felt it really was a responsibility of ours to meet this need and help the aging community with all the things that they're experiencing, including dementia. And I know two of my colleagues are on the call right now that have really done more of the work than I have. But really, that was it for us, that we've got two very robust, busy senior centers. We knew that dementia and this topic was really important. So being a dementia-friendly community was really important to us, and not just the senior centers. I think a lot of you have talked about the importance of it being a city-wide initiative. And that's something that we would like to do in the future, that not just have it be a human services senior center thing, but this is an initiative that really all city staff, all departments in the city should be aware of. And one thing that I think is unique, I'm not sure if any of the other municipalities do it, but that we also our police department and fire departments participate in a critical incident training yearly. And one of those courses is dedicated to information around dementia. So wanted to share that with the group because I thought that was pretty unique as I was listening. I think we have a lot of common themes and doing a lot of similar things, but that one I thought was really pretty neat. And the other thing, Janice, just briefly, one of the things that really brought more of a light to dementia and the struggles are the isolation of the aging community post-COVID. So probably similar to a lot of you, we serve vulnerable populations here in Human Services. So when the pandemic hit, it hit them the hardest. And climbing out of that isolation is something that we're focusing on right now. And the staff at the senior centers applied for a grant through Maricopa County, an isolation grant. And that has proven, that's happening right now, to be really successful in getting people out of their homes, connected, engaged, and really whether it's being able to identify these issues or simply just getting people out and connecting, that has been a really powerful tool. And I want to just recognize, the Scottsdale staff for recognizing that and getting that going. So that's some of the stuff that we're doing here, but definitely appreciate this. This has been really informative. So thanks.
Thank you so much, Kira, and thank you to our whole panel. And Amy, direct us of what you would like us to do next, or is it just time to wrap up this portion?
No, this is great, Janice. Thank you so much. And thank you so much to our speakers. Really appreciate you joining us today. We do have 5 minutes for questions from the committee. Does anyone have questions for our panelists?
Amy, I've got a quick question. I am curious, how do they do a brain check? When I was fascinated by that too, but when they come out to do a brain check, what happens? I picture like this thing coming on your head, but I'm sure that's not what happens.
Well, it's not that exciting, Kira, or scientific. Michelle, do you want to share?
I'll be honest, I am not the expert on dementia or any of the technology that is, used for these testing, but we wanted to simplify a process that we were able to see as many folks as we can. We did do 30-minute, I think they were 30-minute assessments, which is a questionnaire, and it basically is something that they're able to use. And then from there, they could be advised to schedule an appointment, more in-depth appointment. And then we changed it to make it like maybe less than 10 questions that people are able to do on the go. The question is this normal aging of the brain, or is there something else that I need to be concerned about, right? And so we were able to stop them in their tracks and get them to question that, right? And I think working with Janice and her team, and we've had specialists come out and do some of the assessments and guide people. And I think that is where we need to be when when we're talking about intervention and prevention, is asking those questions and having a tool right there. And then staff was on site to actually schedule appointments, free appointments for folks. So Janice, do you want to add anything on the technical world?
I want to say thank you for that description. And I see Francisco waving, and I was thinking of him because they do a great service for the community.
Yeah, so at each of our cafes, we have, the memory cafe, then we have an educational component that our staff provides, but then we also offer free 88 screenings. So basically we partner with the Pinal County and they taught our staff how to facilitate the 88 screening tool. It's just basically like, I think it's 8 or 10 questions itself. And then that's something that the individual and their caregiver can complete together, but our staff members can help them complete it as well. And we kind of see it more like a blood pressure check or like, your glucose checks. That way they can kind of check in with themselves and see where they're at and kind of go back and score. So that's one of the things that we offer at our centers as well. And we offer it the same day that we offer our memory cafe.
Thank you, Francisco.
And Janice, I had a question. I think you said there was a new one coming on board.
Yes. Does the community that is here want to share this information, or should I share it for the very first time because you might not even know yet? It is so hot off the press, guys.
Well, I assume you're talking about Gilbert, I hope.
Yes, I am.
So yes, we just got our notification, I think 2 days ago, that our application was accepted to be dementia friendly. So
thank you so much to the whole team in Gilbert. What a great team. And when I think about their team and the people who are living with dementia right now with a loved one or someone who has actually passed, and the people on the team who just care about them, it's phenomenal. So thank you, and please share my congratulations and thanks with the whole Dementia Friendly Gilbert team.
Yay!
Okay. Everybody's doing a great job.
Awesome. Yeah, I want to give a shout out to Blair Cepeda from Home Instead, who initiated and spearheads Goodyear's Dementia Friendly committee.
And Christina, thank you for being on our team in Buckeyes. I mean, in Goodyear. Nice to see you.
You too. All right. Well, thank you everyone who has participated in that panel and for all the important work that you're doing. I really appreciate it. And I have made a goal for myself to become a dementia friend. I'm going to do that training, and I challenge you all to do something similar. So thank
and
you.
if you'd like me to, Christina, we're getting ready to have the flyer for the virtual sessions for next year. If you'd like me to, I can send that to you and you can share it with your colleagues.
Most definitely. That would be great. Thank you. All right, moving on to item 6 on our agenda. During our meeting in November, we received an update on the results of the survey conducted as a part of this regional human services assessment. And during the meeting, this meeting now, we're going to get an update on the interview results and the input given by the MAG Human Services and Community Initiatives Committee. Shout out to Melanie, who did a fantastic job representing us. I was tuning in, listening quietly from the margins, and I meant to send you an email, and sorry that I didn't get to that, but you did a great job. Thank you for that leadership. So I distracted myself. The MAG Human Services and Community Initiatives Committee and the Regional Domestic Violence Council from their meetings last week. So I encourage you to offer any input on options to change the committee structure moving forward. And yes, you heard that right. That's a spoiler alert. Amy's going to share the information and some suggestions regarding committee structure for human services in the region. Amy, your turn.
Thank you very much, Madam Chair, members of the committee. Really appreciate your support. We've been working on this together for a number of months now, and we've gotten a lot done. And I really appreciate everyone coming to the table because your perspectives are particularly important because our number one goal throughout this whole assessment is to be able to align the regional efforts with your local priorities. And it helps to hear from you directly about what those priorities are so that we may come closer to aligning with them, and we can do an even better job of supporting them. So the two surveys that were conducted, one was with the Human Services Practitioners Committees, the other was with members of our Management Committee, which are the city, town, and county managers. Those two surveys have concluded, and we shared those survey results with you at your last meeting in November. Our interviews are still going on. We have just a few left that have been scheduled. There are, as you can see, a few pending, or they haven't responded quite yet, and that's okay. We understand people are just super busy. It is our goal to complete the data collection phase of this assessment by the end of December. I leave on vacation next week, so really it's only another week or so. We will have some additional interviews scheduled on kind of a parallel track with stakeholders from the domestic violence community. At our meeting with the Domestic Violence Council last week, they really appreciate all of the data that's been gathered throughout this overall regional human services assessment. There is some very specific work and a very specific perspective to be heard through the domestic violence stakeholders. So we will be conducting those. Hunter on our team, you can see him here. He, I think, just scheduled the first one today, and so that'll be coming up here very soon. And there are a few more underway. So we will have some additional interviews being conducted thanks to Hunter and his support. But otherwise, our data collection phase really is wrapping up this month. We've already started moving into the analysis, and I'm happy to share that with you today. So that you can see in terms of our interview metrics, we have or will have talked to about 36 different communities and community stakeholders. Really thankful for their time. Each interview has lasted anywhere from half an hour to a full hour, and it's helped us to do a much deeper dive than what we're able to do through this survey. And so it's really good to be able to understand the nuances of each community. And it's been fascinating too, because of course, some communities, very large, they have very robust human services departments, they have a number of staff, they receive federal funding, they're expending their own general fund funding. Other communities don't have a human services department. So the conversation changes from what is your human services department doing to what are the needs of your residents? How are you meeting those needs, and how can we help? So in every community, every person has needs. And it's our goal then to find out what can we do at a regional level to support each community, help each person who's living in their community. And these interviews have really been a great way to help make that happen. If we can go on to the next slide, please. Tyler, oh, there you go. All right. So these are the highlights. This is not all that's been collected. I have a spreadsheet that's getting very long now with all of the data that's been collected. These are the highlights though. And in particular, people are talking a lot about housing, homelessness, and older adults. So older adults very much in line with this panel presentation today. So it's a timely presentation. But that being said, they've talked about a whole range of different needs and priorities in terms of addressing human services. And I do think it's important to point out with this too, that all of these needs intersect. You know, it's pretty rare to find a person who only has one of these needs and they're fine on absolutely everything else. I mean, sometimes that happens. But often if someone is needing help with transportation, they might also need help with food, and maybe their challenges with transportation are stressing them out so much that turns into mental health issues. You know, just all of these kind of blend into each other. And I think that's a really important point, because people live their lives holistically. It's all in one continuum with various aspects. It's diverse. And the solutions need to be holistic as well. And our process needs to be holistic and not siloed. So just some important points. You know, I was doing a deeper dive into the survey results after your meeting last month in preparation for the Domestic Violence Council meeting last week. And only half of the Domestic Violence Council members who responded to the survey cited domestic violence as their top priority. It was in their top 3, but it wasn't necessarily their highest priority, because all these other issues impact their ability to serve people who have been through domestic violence. So it just underscores the interdisciplinary nature of the work that we're doing. If we can go to the next slide, please. So these are some of the main themes. Again, not all of the details, but the main themes. We appreciate hearing that people appreciate MAG, particularly people cite our data quite a bit. We do pride ourselves and really strive to always drive with the data to give you good quality data that you can trust, you can come to really know deeply, and then you can make good decisions based on that data. Also, our skill set in terms of convening different stakeholders and bringing them into that kind of neutral and trusted forum, I think is really important. And we strive to maintain that at all times. is recognition of the legacy issues like homelessness, domestic violence, but then there's also a lot of interest into diving into some new areas for MAG. I think at our last meeting, we talked about some initial interest as an area to be explored, where maybe we could offer regional cooperative procurements, where we can offer say a request for proposals or an agreement that has that cooperative language, so that you don't have to do your own solicitation. You don't have to go through the whole process. You can just leverage the one that's already been done. There's a bit of that going on. There could be more, and that could save you as our stakeholders time and money, and help you to put those very important goods, services, and products out into the community even more quickly. Overall, we're hearing a lot about, let's not just meet to meet. People appreciate the information, they appreciate the data, but they want to be able to do something with it. And I think that's a really important point. If we're just sharing information, we can just email information, you know. The networking and the relationship building is incredibly important. We don't need minutes and agendas to do that. We could get together and have coffee, you know, or have kind of a networking group. So hearing a lot about, let's focus on the impact. What are we doing together? How are things different because we've come together? And sometimes we can't really point to something concrete, but we need to be able to do that. We want to be able to do that. So I heard a lot of openness about reconsidering the current committee structure, and continuing to value each person's contributions, but providing maybe a different kind of outlet that really helps people to lend their talents, their time, maybe in a more meaningful way, and in a way that really drives to action. And it's holistic action. It's, you know, breaking down those silos. It's being able to work very quickly together and having a real focus on that action. What are we doing together? Sometimes if we look at the action that we take in the meetings, if the only action is approving the minutes of the last meeting, is that action moving us forward? Maybe not. It's harder at least to demonstrate, you know, from that. If we can go to the next slide, please. So this is the proposal that's out on the table. Really want your feedback on this because this very directly impacts you as a committee. The idea is that we would form an overarching human services coordinating committee, and that coordinating committee then would deploy action teams. And those action teams would have a very specific scope, timeline, and set of deliverables. And when those have been achieved, the action team would disband. And then that would free them up to join another one. And so the idea is that 1, 2, 3 maybe of our human services committees right now, again, holding the continuum of care separate because they have a very clear mandate from HUD, a very prescribed structure. But perhaps this committee, the Human Services and Community Initiatives Committee, maybe Domestic Violence Council would dissolve. You as members would be invited to apply to serve on this Human Services Coordinating Committee. You would also absolutely be invited to serve on the action team. So if you have a particular interest, maybe it's dementia-friendly communities. Maybe we could have an action team on that, and we would set out, this is what we're going to do together in the space of dementia-friendly communities. You would serve on the action team. When that's done, we'd say thank you, and then what's the next action team? Where else might you like to engage? Another opportunity as well could be in terms of having kind of stakeholder lists. It's been referred to in other circles as an editorial board, where it's a group of subject matter experts, and they are kind of on call. And so that if we have a report, an issue, a project that we'd like to vet, if there's an issue arising in the community where you would like to take action on it, then we would activate folks from that a stakeholders list. But it would also help us to mobilize very quickly with the action teams, because we would have a group of people where we would be maintaining that relationship, and then you could come in when we could do something together. The idea is that this new overarching committee then would be deploying those teams each year, and there might be a kind of a pre-action team that's helping to gather the data that would help the HSCC to identify which action teams need to be formed and what should they do, basically. So what is their scope? What is their directive? What are they trying to accomplish? And it's hard because we have quorum today. We have a great representation. Some of you have been serving on this committee for years. This is one of the 2 founding committees for the Human Services Division. So it means that this committee has been around for almost 50 years. That's a long time. There's a lot of legacy, a lot of expertise. We want to make sure that we're using your time in the best way possible. And I know, or I can imagine that it's sometimes frustrating to come into a meeting and wonder, what did we just do together? And what's our purpose? What are we doing next? So there's different ways that we can address that concern. This is one of those options. And this is the first conversation in a public forum with a committee. And we wanted to have this conversation with you first because this very much directly affects you, and you have the expertise to help us navigate that question, to help us answer that question. So really hoping for your candid feedback now in this committee meeting. Also, please do feel free to contact me afterwards if you'd like to have a conversation offline about any of this. But the idea is that we very much hope that all of you would continue to be involved, be in a different format, and would love to get your thoughts on that. Jason, would you like to jump in?
Yeah, so Madam Chair and everyone on the committee, I think these ideas are great. I'll just be blunt. I think that I really appreciate the thoroughness of the process of engaging with folks and you know, asking our thoughts and getting our opinions and letting us be really candid on the things that are really working well, but also those things that could be some opportunities for improvement. I like this very specifically because I think that it will allow us to both honor a lot of that history and a lot of that expertise that is there, as well as to bring in some new voices, some new energy through those action teams or through in other ways that I think can really add a lot of value for current projects and then set us up for future projects. So, you know, from my 2 cents, and I am one of those folks that's been on this committee for a long time. I think that the big joke is that every time I go to a different job and then come back or whatever, I just put back onto this committee. And I don't know if it's year 9 or 10 or something like that. I forget, but I do think that this can really set this group up for long-term success, especially, you know, as human services is so critical and there's so much changes happening like on a normal year, and the next few years is going to be just a little bit different. So I think this is a great idea, and I just applaud yourself and staff.
Thank you very much, Jason. I appreciate that. Other thoughts, other perspectives? I do want to point out that I purposefully brought this through just for information this month. I would not want you to jump on something, try to absorb it, and then take action on it right away. So the idea is that we would schedule this for the January meeting for whatever action you'd like to take. And if it's go back to the drawing board, figure something else out, totally happy to do that as well. Again, this is the first conversation, and really look forward to your feedback to help us refine this and to strengthen it. Other thoughts or questions at this time? We do have a little bit more information to provide, so you'll have other opportunities too, but just wanted to take a pause right now just to see if any thoughts. Melanie?
I can't find my hand, so I'm just raising my actual hand.
That's okay.
I also support a new direction. Again, I've also been on for a very long time. I think ever since I've had this job, so like 8 years. And and again, I've been on a few other things through MAG where it really does feel a lot better when you have something that you feel like you're very specifically looking to accomplish or develop, whether it's a policy for or a program or, but to have an opportunity where it's not quite as formal is what I'd be looking for, so that you really can have that. You're not so agendized that you can't go off on a tangent, not that you want to run down every rabbit hole, but sometimes that's where the valuable conversation comes in and you really get to move and have some progress. So I would love to see that instituted. And again, I do think there's definitely ways to keep people engaged, making sure people stay on a list so that when you've got that item of interest or area that you can reach out to those subject matter experts to pull it together to, be like, but then it really does let people kind of move and rotate around a little bit to participate at different levels. And I think that's the other thing is getting people engaged at all different levels. And that's not what we've always had sometimes too, I think, is knowing who's best to be at the table. you know, type of thing. You're like, you know, I'm like, I don't know if it's sometimes me. Whereas I'd love to pull in a coworker, go, hey, I need you to go to this because this is what they're going to be doing this time. And I think you're more adept at that and you know, be able to participate. So I like the new direction. I do feel it's time to try something new. So we've had a lovely 50 years, but I'm excited to see something, you know, maybe a little bit different moving forward. So thank you for all the work.
Thank you, Melanie.
Well, from a chair's perspective, I will say I'm happy with this proposal as well. I have been trying to help our group find a purpose beyond the SSBG recommendations, and I have been learning the bureaucracy of this process. And so those conversations that we've been having that got us to be able to have a great panel like we had today, for example, we're walking the line in terms of what is appropriate MAG format for meetings, because, you know, if things aren't agendized, we can't be sharing best practices until they get on the agenda. So having a less formal work environment for us in response to priorities raised by the HSCC will bring the right people together that are engaged and interested in participating in those conversations and having a meaningful impact on human services in our region. So thank you, Amy. Once again, you, I think, have hit it out of the park in terms of collecting data, synthesizing it, and developing a proposal that's actionable. And
thank you very much. Thank you very much, Madam Chair. And just a note too, I mean, if there's interest in having panel presentations on things like dementia-friendly communities in the future, having a conversation doesn't need an action team. It doesn't need an agenda necessarily. So if there's interest in something, we can put it out to the list. We can put it out to throughout our network and then be able to come together around that as well. Things like SSBG also could continue as an action team. And so we can do that. And if you'd like to be involved, please come together. We'll take action and then we'll move on to something else. And as we're looking at other activities that we do each year, we can still do it. We're just looking at how can we do it more efficiently and maybe more effectively. If we can go to the next slide, please. Oh, okay, that was the last slide on that. So our time frame for this is that we would come back to you. We've got a fuller Word document that I'd like to share with the committee. I'd love to get your thoughts on it. I'll be sharing it out as well with everyone that's participated in an interview with us, just be able to circle back and say, this is what we heard and this is what we're proposing based on what we heard. It's really important to get lots of fingerprints and eyeballs on this because it's a big change. And we want to do something with you and something that's going to help us work together even better. And your clear, candid communication on this is really critical. So again, if you'd like to reach out to me separately after the meeting, please feel free to do so. I'm happy to spend the time with you. We don't right now have a meeting scheduled for January. We're looking at, I think, Christina, Madam Chair, we said January 14th at 2 o'clock. I don't know if folks can kind of check their calendars and maybe give me a thumbs up if that works for you. I'm happy to follow up by email afterwards as well. Just wanting to make sure that we can secure a date when hopefully all, if not all, then the vast majority of the committee can come. Thank you, Chris. Thank you, Santiago. So if that works for you, let me know. We can get that meeting invite out and I'll be sharing that document with the full committee too. So you have plenty of time to really dig into that, consider it, ponder it, and let me know if there's anything about it that could be strengthened, removed, changed, added. Really just look forward to any feedback that you might have on it.
What was the date, Amy, that you said for January?
It's Tuesday, January 14th at 2 o'clock. Seeing quite a few yeses. Eliana, that works for you too. Jason, yes. Karen, thank you. Susan, does that work for you too? I know, Chris, you put your thumbs up. Christian, does that work for you too? Perfect. Thank you. Kara?
And I'm sorry, Amy.
Yeah.
It's Susan. Unfortunately, that does not work for me.
Okay.
But it sounds like I'm in the minority.
Okay. Okay. I'll go ahead and send it out by email just to double check everybody. And then if folks can't come, but you'd like to meet either before or after that meeting, please let me know. Happy to schedule the extra time. And if you're able to send a proxy too, then that would be fantastic. But it looks like right now we would have quorum, but I'll just send out an email just to follow up. But if you could please everyone hold that time on your calendars. The process after that then is after your action in January, that would go to our Human Services and Community Initiatives Committee that same month. We're looking at January 21st or 28th, checking availability with those committee members. For the Domestic Violence Council, looking at this going to them in January for their information and for their action in February. And then if all of you could please be holding March 18th from 10 a.m. to 2 p.m. That would be occurring at MAG. And that would be when any of the committees that are affected by this will have already voted to recommend approval of this proposal. March 18th, we would be coming together then to start building out what does the operational plan look like. And so that would include a plenary session where we're all together, as well as breakout sessions based on topic, where people can go into a deeper dive into particular areas of interest. All of that would help us to be really ready with a comprehensive plan and your full support and recommendation for whatever final product we're proposing to go to Management Committee in April, and then to MAG Regional Council at the end of April then for a final approval. The idea after that is that in May, we would open up the membership then for that overarching Human Services Coordinating Committee. I'd encourage you to apply and to think of others. During the March 18th meeting, we'll be talking about what's a criteria for membership and what kind of process can we offer to that committee to make sure they have ample input from a variety of different sources and data to help them make really informed decisions, because that's going to be critical moving forward. And then we would open up that process in May for membership, close it in June with the approval, and then the new committee would be ready to start meeting then in August after some preparations were made over the summer months. Christian, do you have a question or something to add?
Just a quick remark regarding the January 28th date. I think many folks may be participating in the point in time count, so I don't know if that affects everybody's schedule, but just
I
want to put that
know,
on your
it'd be in the
radar.
afternoon, so we're gonna be really tired if it turns out to be on that day. I'm kind of hoping it's the 21st, but I wanted to offer 2 dates to the committee members. Thank you for offering that. Yes, I'm a morning person, but by dinner I'll be asleep on that day in particular. Thank you. Any other thoughts or questions on this? And please do reach out if you have anything that you'd like to share offline. Otherwise, we'll be back as a full group then in January to continue this discussion. Thank you very much for your time and your input. Madam Chair, back to you.
Thank you. Great work. Request for future agenda items, especially based on what we just talked about. I'm gonna assume the answer is no. Does anyone have any brief updates or news to share with the committee? If you have questions for one another, we should reach out and do that after the meeting, because as I was alluding to before, the protocol, we're not allowed to discuss or take action on any comments shared at this time. So if you're sharing about a new program or initiative, please include the source of funding and any impacts achieved. Anybody have anything to share? Then thank you for attending today, and with no further business, this meeting is adjourned.
Thank you, everyone.
Thank
Have
you.
a great
Great to
holiday.
see
Thank you. Have a great day.
Happy
Yo, happy
holidays.
holidays.
Bye.
Happy holidays.